Hi, my name's Linda. I'm 30 years old. I'm Maggie's eldest daughter, and I've taken a pretty active role in supporting Mum through her lung cancer journey. Initially, when we were told the prognosis, which was quite poor actually, it was 12 to 14 months post-diagnosis, I couldn't accept that that's what would that's what would pan out for my mother. I just felt like there was information that we weren't getting, and so I didn't accept that that was what was going to happen. And the more research and the more reading I did, the more comfortable I got that that's not what was going to happen, and that it wasn't going to be a death sentence for my mother. A lot of the information that's out there is outdated. And so I also found that it's really important to make sure that if you are doing research, particularly on the internet, that you make sure that you understand where you're getting the information from. A lot of the statistics are outdated, and particularly in the last 5 years, there's been a lot of advancement in the chemotherapy drugs and targeted therapies for lung cancer patients. It's so important that you're comfortable with the physicians treating you or your loved one, and very early on I was uncomfortable just with the way things were going. The lead time between when a test was done and we got the results, I felt was unacceptably too long, and I don't know, I guess because I'd done some research that I felt was quite informative, it just didn't tie back to the treatment that my mother was getting, and so I just felt that we needed to speak to somebody else as well, and I'm glad we did, because it makes such a difference. I think depending on which hospital you go to and who's treating you, the treatment options can take a very different path. I just felt that the treatment plan for my mother at the first hospital was not aggressive enough. She's young, she's fit, and she's never smoked, and so I just felt that they could do a lot more. It really felt like you're just in the system. You're a number. Well, it was more like they had a method for dealing with people with lung cancer. But you could have been a triangle, but their system is a circle. So they just try and slot you in what mold they have already established for you. Whereas I really felt that the other hospital we went to, they tailored your treatment plan, Mum's treatment plan, around her stage, around her. The fact that she was fit and healthy and younger than most people, and that she could tolerate the treatment, that's what determined her treatment plan, not the general this is how we do it kind of approach, which I felt was the way it was looked at the other hospital. We felt like victims to start with. I felt like a victim. How dare this happen to us? And so did Mum. But then as soon as we started to take an active role, as soon as I felt that I understood what was happening, then we felt so much more confident about it. You have a choice. You don't have to do exactly what they say. Obviously, the doctors know best. That's what they're trained and experienced in. But I think it's really important to understand also that there is no one single best approach with the stage of lung cancer, stage 3, that my mother had. And so there are different ways to approach things, and being across what those different methods are puts you in a better position to be able to ask appropriate questions when you see your physician. I'm feeling really positive about the operation. An operation isn't the end of the treatment. It's just one part of the treatment plan for my mother. But going from you are incurable and you are inoperable to having an opportunity to have the tumour resected is really positive. It's great.